You know when you get a standard blood test back, you probably glance at your red and white blood cells, right? But there's another number on that report that's absolutely crucial, your platelet count. These tiny little things are the unsung heroes of your blood, and today we're going to put them right in the spotlight.
I mean, really think about it. You get a tiny paper cut, it bleeds for a second, and then it just stops. It seems like magic, but it's not. That's your platelets jumping into action. They are your body's own little emergency response team, and understanding them is a huge piece of the puzzle to understanding your overall health.
So, here's what we're going to cover. First, we'll get to know these tiny first responders and find out exactly what they do. Then, we'll get into the balancing act of the platelet count, what it means when the numbers are too high or too low. We're going to look at the real-world consequences, from dangerous clots to uncontrolled bleeding, and we'll finish up by looking at how doctors figure out the root cause of it all.
Okay, so let's dive right in with the basics. Who are these guys, and what exactly is their job?
Well, platelets, or thrombocytes, if you want to get technical, are pretty fascinating. They're not even complete cells. They're actually little fragments that break off from these giant cells inside our bone marrow. They live a pretty short and sweet life, zipping around your bloodstream for about 7 to 10 days before they get recycled. And their one big mission? To plug any and all leaks. I like to think of them as an emergency road crew. The second there's damage to a blood vessel, a little pothole in the highway, an alarm goes out. Platelets are the very first to show up. They immediately change from these smooth little discs into spiky, sticky balls. They all pile on top of each other, form a temporary plug, and then they release these chemical signals that call for more backup. So they don't just stop the bleeding, they actually kickstart the whole healing process. Pretty incredible.
Now, for this whole system to work like a well-oiled machine, you need just the right number of responders. Not too many, and definitely not too few. This is where your platelet count becomes so important. It's a real balancing act.
So for a healthy adult, the sweet spot is somewhere between 150 and 400 billion, that's billion with a B, platelets per liter of blood. Yeah, that number sounds absolutely massive, and it is. But that's the target zone your body is constantly aiming for. Different labs might have slightly different ranges, but that's the general neighborhood we're in. But, and this is a really big but, normal isn't some fixed, rigid number. It can actually move around a bit depending on a bunch of different factors. Kids, for example, often have higher counts that just naturally come down as they get older. And for women, the count can take a little dip during menstruation or pregnancy. So if a number is slightly off, it doesn't automatically mean something is wrong. Context is absolutely everything. Okay, so what happens when that balance gets totally thrown off? Let's start by looking at what it means when your body has way too many platelets on the job. The medical term for this is thrombocytosis. It's a bit of a mouthful, I know. It's generally defined as a platelet count that's climbed above 450 billion per liter. Basically, the body is just making way too many of these sticky little clot formers. Now, this is probably the single most important thing to get about high platelets. For the vast majority of people, we're talking 80 to 90% of the time, the high platelet count isn't the actual problem. It's what we call reactive. This just means the body is reacting to something else going on, like an infection. The high count is a symptom, not the disease itself. Only in rare cases is it a primary issue with the bone marrow, and that difference is huge. So, what kind of stuff can set off this reaction? Well, think of it as your body's alarm system going into overdrive. Platelet production can ramp up because of an infection, because you're low on iron, or due to chronic inflammation from something like rheumatoid arthritis. It can even happen after a major surgery. In all these situations, the high platelet count is just a big flashing sign that your body is busy fighting some other battle. All right, let's flip the coin. Let's look at the other side of the problem. What happens when your body doesn't have enough platelets ready to go? This is called thrombocytopenia, and it's diagnosed when the count drops below 150 billion. This usually happens for one of 3 reasons. Either the factory in the bone marrow isn't producing enough of them, or they're being destroyed in the bloodstream faster than they can be replaced, or 3, they're getting trapped in an enlarged spleen. Now, it's not an all-or-nothing thing. There are levels to it. If it's mild, you might not even notice any symptoms. But as that count drops down into the moderate and severe zones, the risk of bleeding starts to go way up. Spontaneous bleeding usually only becomes a really big worry when the count gets very, very low. And one of the most common culprits for a low platelet count might be sitting in your medicine cabinet right now. Seriously,
Over 100 different drugs can cause this, including really common things like certain antibiotics, pain relievers like ibuprofen, and prescriptions like heparin. This is exactly why a doctor will always ask for a complete list of your medications first.
Okay, now for a really wild card, something that sounds like it's straight out of a TV show. Sometimes, a low platelet count on a lab report isn't actually real. It's a phantom result. It's called pseudothrombocytopenia. See, for a small number of people, the stuff in the blood collection tube makes their platelets clump together. The lab's machine sees a big clump and counts it as one single platelet and spits out a super low number. It's not a health problem at all. It's just a weird quirk of the test itself.
So, high numbers, low numbers, what's the big deal? Why does all this matter so much? Well, this is where it gets real, because being out of balance puts you at risk for two very different but very serious dangers.
It really is a tale of two extremes. With too many platelets, thrombocytosis, the main danger is unwanted clotting. All those extra platelets can start to form clots where they shouldn't, inside your blood vessels, which can block blood flow and lead to a stroke or a heart attack. On the other side, with too few platelets, the risk is all about bleeding. This can be as simple as bruising easily or getting nosebleeds, or it can show up as tiny red dots on your skin, which are actually little pinpoint bleeds. In the worst cases, it can cause dangerous internal bleeding.
So when a blood test shows an abnormal platelet count, whether it's high or low, that number is just the first clue. It's just the beginning of the story. The next and most important step is to play detective and find out why.
The investigation follows a really logical path. First, you got to confirm the number is real. That usually means a retest, sometimes with a different kind of tube, to rule out that clumping issue we just talked about. Next up is a deep dive into your history. What meds are you on? Any recent sickness? Then you move on to more specific tests, like checking for inflammation markers or iron levels. And in some complicated cases, a bone marrow biopsy might be the only way to get a direct look at the platelet factory itself. At the end of the day, your blood count is so much more than a list of numbers. It's a story, a dynamic story about everything that's going on inside your body. And platelets are a main character in that story. They can signal anything from a minor reaction to a much bigger issue. Knowing about these numbers and being able to talk about them with your doctor is just a really powerful way to be an active part of your own health story.